300 million people in the world carry the thalassemia trait. That means they have the tendency to give one or the other form of thalassemia to their children. Thalassemia is an inherited blood disorder. That is, parents give it to their children through their genes. It is there in their genetic makeup. So it goes on from one parent to the next generation and on to the next. At the moment, 60,000 children are born every year with beta thalassemia major. And their only way to survive is by getting regular blood transfusions. So let's talk. What is it? Let's have the awareness so that we can recognize the symptoms easily and try to help out our near and dear. I'm Dr. Marium Ateeq. Now, in thalassemia, the body cannot produce a specific type of protein, the hemoglobin. This hemoglobin is a major component of the red blood cells, the RBCs, whose function is to carry oxygen as they are present in the blood. So when the hemoglobin will be less, there will be less number of the RBCs, the red blood cells, and their oxygen carrying capacity will also be less. So the blood is going to carry less oxygen and all the entire body functions are going to be affected. What happens? The hemoglobin is made up of chains of proteins, basically the alpha chain and the beta chain. These chains, alpha A, alpha 2, beta 1, beta 2, these are somehow not being produced properly by the body. As a result, the hemoglobin that is produced, the RBCs that are produced, they are defective, they are unstable, their number is less. So they break down easily and they cause all the different effects. The types are named according to whatever component is deficient. It may be the thalassemia A type or thalassemia B type. The beta thalassemias are more common in the world. Another way of classifying them would be as minor thalassemia, which has got no symptoms at all and is just an incidental finding while you are being investigated for some other problem. And they really need no treatment, but that is a diagnosis that they are having the thalassemia trait and they can later on give it to their children. Then is the intermediate type, in which normally there are no symptoms, but as and when if the body goes under some kind of stress or is suffering from some infection, then they can go into more severe anemia and may require blood transfusions at times. Whereas the major type, this is the type which is the dangerous one, in which regular blood transfusions are required. Without that, survival is not possible. The prevalence is equal amongst both men and women. So how do you recognize these people? As it is an inherited disorder, that means the parents are giving it to their children. So there is a very close link with history. When you see that there are family members who are suffering with regular anemia and they have this thalassemia trait in them, then you need to be very, very careful. How do you recognize the people? They will show specific symptoms. Now, when the oxygen carrying capacity is less, so all of the body functions will be less. The energy level is going to be less. There is going to be more fatigue, more tiredness. You are going to feel breathless. The heart rate may be accelerated to compensate for this lack of oxygen. Then, due to the regular breakdown of the RBCs and lesser number of RBCs, you are going to be anemic. Therefore, the overall complexion is going to be pale. Then, the spleen is one of the organs that is responsible for making these red blood cells, then for filtering the correct ones, the healthy ones, and taking care of infection also. So in this, to compensate for the less number of RBCs and the defective ones, the spleen will be in an overdrive. So it is going to enlarge, and there will be protruded abdomens in these patients due to hepatosplenomegaly. In the same way, the bone marrow also produces the red blood cells, which is the central part of the bone, the dark spongy part that is producing all these RBCs. Again, to compensate for the lesser number of RBCs, the bone marrow is also going to go into an overdrive. As a result, the spongy area is going to stretch, the bone is going to expand, and deformities of the bone can be seen, especially in the maxillofacial area. People with the major type of long-standing thalassemias are going to have a typical thalassemia face, in which the cheekbones will be very prominent, the nose bridge is going to be depressed, and their maxilla, their chin is going to protrude. So they will give a typical rodent-like, squirrel-like, chipmunk-like appearance. Then, because the spleen is also helping to fight infection, when the spleen is not working properly because of enlargement, the body will be capable to get into infections easily. These people, children or adults, may be falling ill more than the others. Similarly, when the bone is being expanded and stretched out, then it is going to thin out. The bones are going to be brittle, and these people have more chances to suffer fractures. Overall, growth of the person is going to be decreased. They are going to face slow growth. So, the urine is going to be dark because the RBCs will be breaking down more frequently. And these bile pigments are going to give the urine a dark color. And similarly, if it is going on more and more, then this yellow discoloration can come in the sclerae also, and they may present with jaundice. So when all these things are happening, you consult the doctor. They are going to screen you for the blood workup. There is going to be a simple, complete blood count, which is going to show that you are anemic. Then depending on the other values in this, the hematologist may ask you to get hemoglobin electrophoresis, especially if there is a family history too. Now, how do you treat it? The treatment is that these people will require regular blood transfusions. For that, there are certain risks also, but along with that, you can have a good diet and you can take supplements which are rich in folic acid, either by eating or as a supplement form also. All these things, the lentils, the egg yolks, the cereals, the whole grains, these are rich in folic acid. So these have to be included in the diet, and plus supplements can be taken so that more RBCs and healthy RBCs can be formed. Blood transfusions, we have already discussed that the minor ones will need none, intermediate ones will need sometimes, whereas the ones suffering with major thalassemia are going to need it routinely, depending from person to person. Some may require it every week, some may require it every fortnightly, or some may require it in a month or so. For that, you have to enroll yourself with the proper hematological services, and you have to get it done regularly. Now, with all these blood transfusions, there are certain risks also which are involved. These risks are that due to the extra RBC breakdown, there will be excessive iron in the blood, and there can be iron overload. Iron can go and get deposited in organs such as the heart, the kidneys, and the brain, the liver, the heart, the liver, and the brain. So to prevent this, they need chelation therapy. They are either in the pill form or as a subcutaneous injection. It will be given to the patient so that the iron does not go and get deposited in these organs and their functioning is not disturbed. Then there can be the alloimmunization. In alloimmunization, due to not proper compatibility between the blood that is being transfused and that person's blood, the body of that person can recognize that blood as foreign and can start breaking it down. So in spite of the fact that they are getting the blood transfusions, the body is not accepting them and breaking them down very quickly. For that, proper screening of the blood, proper compatibility of the blood has to be checked. Then again, due to regular transfusions, there may be chances of getting infections such as hepatitis B, hepatitis C, or the HIV. So proper screening has to be done. Now, there is no way that you can prevent the disease because it is a genetic one. It is coming via a person's genes. But when there is a family history, then it becomes your civic duty that whenever you are marrying, you have to check for the other partner. Because if the thalassemia trait is being carried by both parents, that is the mother and father, then there are more chances that the offsprings that are born are going to have major types of thalassemia. So we have to be careful because if you only have the trait, then you may not exhibit the symptoms, but you can give it to the others. Whereas if both have it, then there is maximum chance that the offsprings will be suffering. So you need to take care of this and share the information whenever you are settling down so that your next generation can be healthy. Now, this prevalence, although it is not gender related, but there is a tendency that people belonging to the Mediterranean area, especially Greece and Turkey, they are more prone to having thalassemias. And then people living in Africa, Asia, and the Middle East, they are also more prone to thalassemias. Now, this is all the genetic makeup. We cannot do much about it other than being aware of it. And after all this gory thing, there is one positive thing, that people who tend to carry the thalassemia trait are a little protected against malarias. So some of the experts who study that why these this thalassemia is more in these areas, maybe because there is more malaria in these areas. So it might be a protective mechanism from nature against malaria. But this is all a theory. So please stay safe, be aware, and deal with your thalassemia nicely. Assalamu alaikum.